What if the first sign of cancer did not feel serious? No dramatic collapse, no unbearable pain, no emergency. Just the fatigue that lingers, a small change in your body, a small change and a symptom that you simply explain away. Most cancers do not start loudly. They whisper. And too many people ignore the whisper. Then it becomes impossible to ignore. Today, we are going to look at some of the updated 2025 evidence from the American Cancer Society, the Johns Hopkins University, and the Cancer Research UK. Some of the subtle warning signs people commonly dismiss and exactly when you should take them seriously. I'm not spreading fear. This is awareness, and the awareness could save your life. So stay with me because we are going to look at some of the subtle cancer symptoms that people just dismiss. Hi everyone, I'm Dr. Joshua Derito, a family physician focused on public health and cancer prevention and treatment. Here we break complex science into simple steps that you can use today to improve your health. So let's talk about the symptoms that people ignore, which could be signals to cancer. And if you can identify these early changes, then you can change everything. Why are cancer signs missed? The early cancer symptoms are non-specific. So what this means, they do not have specific prediction that this could be cancer. They look like normal life. The stress, the aging, the work fatigue, and even sometimes some minor infections. Public health data consistently shows that delayed medical evaluation is one of the strongest predictors of late-stage diagnosis. And this is more so in low socioeconomic countries and developing countries like Kenya. We are getting our cancers very late when it is already advanced and it is difficult to treat with the advanced symptoms. So this gives us the opportunity that we do not need to normalize these symptoms. And when people wait, they just hope, but here is the key. Persistence is a red flag for many symptoms. It is not the intensity. So let's look at some of the common signs that people ignore. Let's go through them. Some of the people have dismissed them. And this is what the evidence says. Unexplained weight loss. Losing 5 to 10% of your body weight over a few months without trying, this is not normal. No diet change, no increased exercise. This could be some subtle symptoms of pancreatic cancer, stomach cancer, lung cancer, and esophageal cancer. If the weight loss is unexplained, investigate. Take action. Persistent fatigue. Not the normal tiredness, but deep exhaustion, which does not improve with rest. This can happen due to anemia, chronic inflammation, or even metabolic shifts associated with cancer. If fatigue is new, ongoing, and unexplained, it deserves evaluation. Do not wish it away. Persistent pain. Pain lasting weeks or months without clear injury. New progressive headaches, unexplained abdominal pains, back pain that does not resolve. Most pain is benign. but persistent unexplained pain needs assessment. Changes in bladder or bowel habits, ongoing constipation or diarrhea, blood in stool or urine, narrow stools, difficult swallowing, frequent urination, colorectal, bladder, prostate, and even gastrointestinal cancers often begin subtly. If it lasts 2 to 4 weeks, don't ignore it. Unusual bleeding. You have blood in stool, coughing blood, postmenopausal bleeding, unusual vaginal discharge. Unexplained bleeding always deserves prompt attention. Lumps or swelling. New breast lump. You need to be self-aware of your breast. Neck swelling, testicular masses, persistently swollen lymph nodes. Not every lump is cancer, but new, firm, enlarging and persistent lumps should be examined. Persistent cough or hoarseness. Cough lasting for more than 3 to 4 weeks, especially with a smoking history or heavy pollution exposure. In settings with air pollution, it is not easy to dismiss, but persistence matters. Skin changes, a new mole, a changing mole. A mole is a swelling or a new sore, non-healing sore, darkening or thickening of the skin. Skin cancer often gives visible clues. Pay attention. The pattern that matters. Here is what matters: persistent, progressive, unexplained, or combined with weight loss, fatigue, or bleeding. That combination should trigger action. Not panic, but action. A determined action. Why do people delay seeking care when they have cancer? Evidence shows that people delay because they normalize symptoms. It's just normal. They fear the diagnosis. They assume it will go away. But fear does not protect you. Information does. For many cancers, early stage detection dramatically improves outcome. The difference between stage 1 and stage 4 can be life-changing. Important reassurance. Let me say something very clearly. Most symptoms are not cancer. Majority of fatigues, coughs, pain, and lumps are benign. But the small percentage that aren't are the ones we must not miss. So the goal is not anxiety, it is awareness. When should you see a doctor? Use this rule. If a symptom lasts more than 2 to 4 weeks, is worsening, or has no clear cause, get evaluated. You are not overreacting, you are being responsible. Early evaluation does not mean you have cancer. It means you are protecting your future. So, cancer rarely begins dramatically. It begins quietly. Your job is not to diagnose yourself. Your job is to notice the change, to respect the persistence, to act early. If this raises your awareness, comment, listen to your body. Share this with someone who always says, it is probably nothing. Like and subscribe to the Hope in Healing Cancer Insights channel, and you will get evidence-based prevention. No fear, just clarity. Early detection saves life. See you in the next video. Thank you for watching. May God give you good health and happier life. Thank you.